What conditions are often mistaken for fibromyalgia symptoms? Imagine feeling constant pain, fatigue, and brain fog and wondering if it's fibromyalgia or something else entirely. Many health conditions can mimic fibromyalgia's symptoms, making diagnosis tricky. It's important to understand these conditions to ensure proper treatment. Rheumatologic and autoimmune diseases are common confounders. Conditions like rheumatoid arthritis, lupus, osteoarthritis, and polymyalgia rheumatica often cause widespread pain and fatigue similar to fibromyalgia. However, these diseases usually involve inflammation that can be detected through blood tests, unlike fibromyalgia, which does not show inflammatory markers. Early stages of rheumatoid arthritis or inflammatory spondyloarthritis can look very much like fibromyalgia, so doctors look for signs of joint swelling or specific blood markers to tell them apart. Neurological disorders can also be mistaken for fibromyalgia. Multiple sclerosis, Parkinson's disease, and peripheral nerve damage can cause pain, fatigue, and cognitive issues. For example, multiple sclerosis may cause nerve-related pain and weakness, while fibromyalgia pain tends to be more widespread and generalized. Nerve compression syndromes like carpal tunnel syndrome often cause localized pain, which differs from the diffuse pain seen in fibromyalgia. The key is in the pattern. Fibromyalgia affects the whole body, while neurological issues often target specific areas. Endocrine and metabolic problems are another group of conditions that can look like fibromyalgia. Hypothyroidism, which is an underactive thyroid, can cause fatigue, muscle weakness, and aches. Other hormonal disorders like hyperparathyroidism, Cushing syndrome, and Addison's disease can produce similar symptoms. Vitamin deficiencies, especially vitamin D and B12, are common culprits. Blood tests like thyroid panels and vitamin level checks are used to identify these issues, which are usually straightforward to diagnose and treat. Chronic infections can also produce symptoms that seem like fibromyalgia. Lyme disease, especially in its later stages, can cause widespread pain, fatigue, and cognitive problems. Chronic viral infections such as hepatitis C may also cause similar symptoms. These infections requiring specific tests to identify and are treatable with targeted therapies, making it crucial to rule them out. Other conditions often confused with fibromyalgia include myofascial pain syndrome, which involves localized trigger points rather than widespread pain. Chronic fatigue syndrome shares symptoms like exhaustion and muscle pain but often involves low-grade inflammation and sometimes swollen lymph nodes. Gastrointestinal issues like celiac disease or gluten sensitivity can cause fatigue and pain that overlap with fibromyalgia, especially when accompanied by digestive symptoms. Early signs of cancer, such as multiple myeloma, leukemia, or metastatic tumors, can also mimic fibromyalgia with pain and fatigue. Hereditary muscle disorders and connective tissue conditions like hypermobility syndrome may produce similar symptoms. Certain medications, including statins or some cancer treatments, can also cause muscle pain that might be mistaken for fibromyalgia. Diagnosing these conditions involves a thorough medical history, physical exam, and targeted laboratory tests. Blood work including complete blood count, metabolic panels, and markers of inflammation helps rule out autoimmune, infectious, or metabolic causes. It's important to remember that fibromyalgia can coexist with other illnesses, so doctors look carefully for signs that point to other conditions. Ultimately, proper diagnosis requires a comprehensive approach, and anyone experiencing persistent symptoms should consult healthcare professionals for personalized evaluation and care.